Welcome once again to Diabetes Education Centers of America. And as always, get your A1C blood sugar level checked today. Today we're going to talk about why I kind of started this business and why I'm an advocate for getting your A1C checked and why we work to educate people about diabetes just in general. Um, I went to go get a physical a few years ago, about 4 or 5 years ago, and after they took my blood, I went back a couple of days later for the results, and the primary care comes in. He's probably about 38, 39 years old. Looks like he just got out of residency. He was a young guy, and he says to me, everything looks good, but your blood sugar is high. Your blood sugar is high. So I'm going to write you a prescription for insulin. And he writes out the prescription for insulin and he tears it off and he gives it to me. He gives me some information on needles that I need to get. And he says, I'll see you in 3 months. And he gets ready to walk out the door. So, I'm sitting there and I'm like, well, what's that mean? My blood sugar is high because I knew I was a diabetic and they had me on metformin and gluburide. So I was like, so what changed? Did something change? He says, well, your sugar is pretty high and we're going to have to do something about that. So he decided to put me on insulin. And that was to follow the instructions as to how much insulin I should give myself based on my uh, finger prick requirements, which is a little device that measures your finger prick test measures how much blood sugar you have in your body at a particular time. It's not the same as an A1C. So, he's getting ready to walk out once again, and I said, well, wait a minute. I'm not real big on needles. I mean, is there something else you can do? Is there something else I can do? And he kind of, insulin looks to be best, the best way to go. And I was kind of like, well, that's not going to work for me. So I need another option. So, I've got this weird look on his face, and he's trying to figure out, oh, God, this guy's actually pushing back on a decision that I've made here. So he says, well, I'll tell you what, I'll be right back. So I assume he went out and he talked to his colleagues. And then he came back about 5 minutes later and he said, you know what, we here at Abrazo in Phoenix, Arizona, on the corner of 19th Avenue and Bethany Homes, he said, we do have these diabetes centers. At that time, Abrazo had 5 of them in the valley. And there was actually one right there at the hospital where I was um, presently at. And he said, we can send you there. And maybe someone there can help you better understand how to get your blood sugar under control. So I said, okay, great. So he set it up for me to go over to basically, really, it was just around the corner, I mean, basically behind the hospital. And so about 2 weeks later, he never mentioned, by the way, he never mentioned that my A1C was 12.5. That never came up in the discussion. So he just told me my blood sugar was high, and he wanted to put me on insulin, and that was the direction that he was going to go. And then so I pushed back, and so now I'm on my way to Abrazo diabetes clinics, or like they're like little clinics. So a couple weeks later, about 7 days later, 14 days later maybe, I went over there and I met with a lady. I will call her Miss W, and very very nice lady. She said So you're here to talk about your diabetes? And I said, yes, ma'am, And she said, oh, okay. And I had, done a little due diligence. I brought in um, what they call nutrition labels of everything that I had been eating. And I brought in like 30 of them. And I handed them to her, and she looked at them and she said, oh, very good, very good. And I actually kind of wrote down um, what I had been eating. I came in with a list of items that I had been eating and beverages that I had been drinking. And she looked at that and she said, "Oh, that's very very good." And I said, "So, what designates me having high blood sugar?" And let's go back a little further. Uh, I had these lesions on my hands, on the top and bottom of my hands. They were skin lesions. I also had the incredibly dry and cracking skin on the bottom of my feet and on the top of my toes. I had this condition. Started on my hands, but it eventually migrated to the bottom of my feet. Probably on my hands almost 25, 30 years ago when I was living in Los Angeles. So I had gone to maybe 20 different dermatologists who kept telling me that it was psoriasis, and they gave me these salves, and they wrote a prescription out for the salve and sent me to the pharmacist, and I got the salve, and the salve never worked very well, and I had these incredibly rough and ragged palms of my hands and on top of my fingers were very, very dry, and the skin was thickening, and the skin on my palms were thickening. I had this condition while I'm sitting there talking to Miss W at the diabetes clinic. I never really thought much of it. I never would have thought that that the skin lesions were related to my diabetes condition. But I do remember that I started having these skin lesions probably close to 30 years earlier. So I was in my 20s. I was like 25, 26, 27, and I was still living in Los Angeles. So anyway, I listened to her explain to me what was going on. She told me my A1C was 12.5. I had never heard. My primary care had never brought up A1C. He had never said anything about what it meant and how important it really is. And the lady that I was talking to was actually what's called a certified diabetes educator, and I'd never heard of that title before. This is someone who has taken some classes and become certified in educating individuals about nutrition as it relates to diabetes. And you can become a certified nutritionist, but the difference between a certified nutritionist and a certified diabetes nutritionist or educator is, once again, night and day. So there are things that a certified diabetes educator or nutritionist will tell you to do that a certified nutritionist won't tell you to do, and and um, there's a big difference. You have to be kind of careful. You want to make sure that you're talking to a certified diabetes educator slash nutritionist. So anyway, this W talked to me for literally what I would consider to be an hour and a half, and then I came back 30 days later, I believe, and she talked to me again for about an hour and a half, and I did what she suggested that I do. She was very, very patient, very, very kind, and I really kind of attribute Miss W in saving my life. In all honesty, she actually saved my life, and I made the changes that she suggested. I implemented those changes immediately, and I noticed after about 90 days, my skin lesions started to go away. And after about 6 months, they were completely gone. They had disappeared completely. So I attributed the skin lesions to diabetes, and that's what they were. Yeah, the psoriasis. I don't know why my dermatologist. I must have visited at least 20 of them within a 25-year span. They said it was psoriasis, but it wasn't. It was diabetes, and but she really saved my life, and I still am in touch with her today. And about 3 months later, I had asked for her to meet me for a cup of coffee at a Starbucks, and I told her that I wanted to start a business educating people about diabetes. And that is the origin of Diabetes Education Centers of America. So um, check out the website, decoaa1c.com, and there's a contact number on there for you to give me a holler if you'd like to have some assistance with your diabetes. But I just wanted to kind of go over today how a certified diabetes educator saved my life, and probably saved both my feet and probably saved both my hands, because if I had just listened to the primary care and just went on ahead and started injecting myself with insulin without really paying attention to how high my blood sugar was, especially at 12.5, which is kidney failure level, blindness level. I went and got my eyes checked, by the way. I went and got my optic nerves checked. Um, that's something else that you probably need to do if you're a diabetic. She suggested that I do get my eyes checked to see if the high blood sugar had damaged my optic nerves in my eyes. They had not, so I was lucky there. Um, I got my kidneys function checked, and they were functioning the way they're supposed to be functioning. So I just, all the way around, I was really, really lucky that number one, I pushed back on the primary care physician when they wanted to put me on insulin. And number two, I asked for a visit to talk to a certified diabetes educator at their diabetes center. So anyway, have a great day. And like I said, if you've got any questions, go to the website. Our contact information is on there. Give us a holler, and we'll get you squared away with regards to your diabetes. Have a great day, and thank you once again.